First of all, welcome back to another AHCP webinar, and thanks really for taking time out of your day to invest in yourself. I'm sure you are all working diligently to prepare for AEP and or OEP, depending upon your market, as we are. So for that reason, I especially appreciate you taking the time out of your day to get more familiar with our small group solutions. Whether you are a specialist in the small group market or you just dabble in it, like a lot of us do, being armed with the most competitive products and understanding the strategies for helping small business owners to cost effectively address their health insurance concerns is going to help position you for success by maximizing every opportunity. With us today is Melissa Cook, our small group health expert, formerly from our National General Business Solutions division. In case you haven't heard, AHCP and National General Insurance are now part of Allstate Insurance. So consequently, NatGen Business Solutions has been rebranded accordingly. But not to steal all of Melissa's thunder, I'll turn the show over to her now. Welcome, Melissa.
Hi, Steve. Thank you. Can everybody hear me?
Perfectly.
Perfect. I'm Melissa Cook. I'm located in Milwaukee, Wisconsin. I'm going to be your dedicated sales rep here to help you start to finish. So thank you for the warm introduction. Let's get started right away so we can make sure that everybody, if anyone has any questions, that we've got plenty of time for those. All right, so we are going to get started here. Welcome. Q4 is upon us, as crazy as that sounds. And so we just wanted to make sure that everybody is aware of our product, answer any questions, and kind of go over a high-level overview of what we have to offer as you guys are servicing your accounts this upcoming Q4. We provide a self-funding solution, and self-funding allows small businesses to control health costs while offering quality benefits to employees. So a lot of your your groups might ask, why self-funding? Well, typically the cost is less. We base our rates off of underwritten rates, and so you can see plans are underwritten. So we're looking for groups that are a little bit more healthier, that are low utilizing, that are typically overpaying for healthcare right now. They do have predictable monthly payments, so we are really marketed as a level funded product because we require that the group pays one level premium. We offer quality benefits. We also have stop loss built into our plans, which we'll talk about in just a short bit here. And there's more employer control. We'll talk about some customizable plan designs and how they can take control in just a little bit. And then potential for money back at the end of the year. So our self-funded program is made up of three components. And so we will talk about what is going to be included in the self-funded plan and how the employer can really take control of their costs and make sure that they're paying a fair amount for the utilization of their group. What we offer here at Allstate, formerly National General, is we offer options for groups that are 200 to 500 enrolled. We help the employer save money on costs. And we also give them the tools and resources for reporting and managing healthcare plans very easily. So how this will work is it keeps the employer cost predictable. Like we talked about, level funded is going to be a level premium every month for 12 months. Well, I'm going to talk about the unique program features that we offer. And then our plans give access to many network options or reference-based pricing. So we want to find a fit for your clients. So no matter where your group is located, we have a network option for them or a reference-based pricing option for them. And then your client can receive money back at the end of the year if claims are lower than anticipated and there's a surplus of what they set aside to pay for claims. So what keeps the employer cost predictable? we split off their premium into 3 separate components. The first is plan administration. Allied is our third-party administrator. They handle our claims. They make our plans operate and run. And another thing that we do with this component is we pay commissions. It's just made for general expenses to make the plan operate. So that's the first component of our premium. So what we're doing is we're getting 1 level premium. We're splitting it into 3, into plan administration. Part of the premium is also paid towards stop loss. Allstate is the stop loss provider, and so we are going to pay everything above and beyond what's in the claims fund to protect your clients from having to pay more. So a lot of level funded or self-funded models are meant to target larger groups or larger businesses. And what we hear a lot from agents are, our group is too small, this isn't really good for small businesses. We've taken that large group philosophy and we've made sure that we're going to be protecting the small businesses because we know they don't typically have the money to pay for claims up front. So we'll talk about the claims account funding. The claims account funding is we're setting aside money every month out of the premium to pay for claims for that business to use as claims come in. So typically in the large group space, you've got a huge, let's say multi-million corporation. If Melissa Cook falls down the stairs, breaks her leg, needs pins and needles and surgery, a large corporation will typically self-fund that claim because they've got the money to. Small businesses don't have that ability just because they're not a multi-million-dollar company. So what we've done is we set aside money out of the premium to pay for their claims. And if they have a good year, meaning there's a surplus left in claims account, they're low utilizing, they're eligible to get 50% or 100% back at the end of the year. If they have a bad year, like let's say that one claim of me falling down the stairs and needing pins and needles in my leg exceeds what's in their claims fund, that's when stop loss, like we talked about, will kick in and pay everything above and beyond what's in that claims fund. They never have to worry about us coming back and asking them for more money or plans, not covering what they need to, claims that are coming in. Because if they run out of money in their claims account, stop loss will protect them from having to pay more than what is in there. So those 3 components again are plan administration, general expenses. So this is the portion of the premium that will pay for the general expense of the plan, will pay for our third-party administrator to operate it, will pay for your commissions and just basic expenses. Stop loss to protect the group from ever having to pay more than what's in their claims fund. And their claims account, or what we call their aggregate. So we're setting money aside 1 month at a time to pay for claims that incur through those 12 months. Does anyone have any questions about how our level funding product breaks down? The unique program features are we specialize in multi-location groups. So if you ever have any groups that are in multi-locations, 3 or more that are lives that are in another state than the group is being written, this is when the group would receive a multi-state discount. We have flexible participation and carve-outs. So our participation rules are 50% of eligible or 75 valid waivers. That's another big differentiator is we are able to make sure that our waivers are considered part of our participation, which I know a lot of other carriers do not. And because of that, we typically never really run into participation issues. We mainly are going to be able to write most groups especially some of those harder to place groups that maybe might not be meeting those participation requirements for other carriers. We also do coverage for 1099 contractors. As long as there is a employee-employer relationship, we are able to write the group. And the employers determine the full-time designation. So anywhere between 20 and 40 hours, that employer is able to say, hey, I'm going to offer it to anyone who has worked maybe 30 hours, for example. And because of that, they're able to offer full-time benefits to employees that typically wouldn't be considered full-time, 20 hours, 30 hours. But they're able to determine their full-time designation, which is really, really a big differentiator as well. We have a composite rating, meaning we have 4 tiered rates. We don't work off of any age banding. And then lastly, we have customizable plan designs, which is very, very nice for your clients because most carriers will most carriers will present to your clients and they will say, here's your cookie cutter A, B, C, D plan. We want to make sure that your client is being put first. And so making sure that you ask the question, what don't you like about your benefits? If you wanted to see any changes, where would you see changes? These are questions that are typically aren't asked, and maybe they're going to say, hey, you know what? I really don't like my out-of-pocket max, or I wish I had a copay for this example, for ER copays or diagnostic x-rays and labs. Let us know what is going to be important to your clients, and I will customize the plan design specifically for them. Next, we're going to talk about our product portfolio. So it's pretty hard because obviously we just talked about customizable plan designs. Our customizable plan designs, there are so many levers to pull. When people ask, can I see what plans that you offer, or do you have a list of plan designs that you offer? The answer is kind of no, because we have so many different offerings and so many different options, which we'll talk about. The first thing that we can make customized is the network. So we have full PPOs that we have access to, which is in and out of network benefits, nationwide PPOs. Second thing is we have advantage PPOs, which is in network benefits only. Depending upon your location, we do sell a lot of these because it's not like an HMO where we're telling you that you have to go to certain, a small list of providers. We're able to offer things like Cigna Advantage or Aetna Advantage. Both of them are nationwide PPOs, extremely strong. You're very rare, or it's depending upon where you're located, it's pretty hard to go out of network. And so by offering them Advantage PPO, you're able to offer them in-network benefits with no out-of-network benefits, but your client will typically never go out of network because of how strong our nationwide PPOs are. And it can cut about 7% on the premium. Essentially, if they're going with a PPO versus Advantage, your client could be paying for a benefit that they're just never really using. And then lastly, we have a reference-based pricing platform as well. It's going to pay a multiple of Medicare. It does take a little bit more of education to the client from you, the agent. There's no network, and all the claims are paid the same based on that multiple of Medicare. With our reference-based pricing product, we have a few different options as well. We have Core Value, which is our typical reference-based pricing product. We have Core Value Flex, which is going to be a reference-based pricing product option where they have the option to switch to a PPO mid-year. Clients or agents typically sell this if groups are wanting to save money, but they're not 100% bought into reference-based pricing, so they need a little bit of a safety net. The ability or just that peace of mind that if they do have any hiccups with reference-based pricing, they can switch to a PPO mid-year really helps the client feel comfortable with that sale. Like I said, reference-based pricing does take some education. You hear things that can happen, balance billing or access issues. We've taken those pain points and we've really managed them and created a different type of system for your clients. So what that means is that if a client ever gets a balance bill, they would call a member advocacy service team, which is us here at Allied, or excuse me, Allied is who handles it, who's our third party administrator through Allstate. And they would make sure that they reach out to the provider, and all of our balance billing, as long as we're aware and they were made known that they did get a balance bill, all of our balance billing is going to either be paid or negotiated on the behalf of the employer and the employee. They never have to worry about paying that out-of-pocket balance bill as long as they let us know, which is a lot different than other carriers where they threaten litigation. Balance billing may be subject to the employee or that member paying. We handle it all. As long as they give us a call or email us or let us know that they've received a balance bill, we will pay for it. The other headache that can happen with reference-based pricing that's been heard of in the past is access issues. If a member ever did have an access issue, they would just give us a call and we will get on the phone with the provider, and most times they're able to be seen. Like I said, that rarely happens, but it can, and so the employer needs to make the choice of potentially making a service call and saving upwards of 20 to 30% versus some level funded carriers and fully insured. Or they need to decide, if this is something that they're going to be able to educate their clients on. And that's where that responsibility really falls on you, the agent. And what I'm here for, to help you with an employee meeting, an employer meeting, and explaining this. We have a lot of tools now with Allstate where we've got a video to explain reference-based pricing. We also have a PowerPoint to explain reference-based pricing. So don't ever feel like, we're just going to leave you high and dry and make sure that your client, is educated just based on what you say. We're here to help. And the last reference-based pricing option that we have is core value access. So this is a reference-based pricing plan with access to PHCS for practitioner or ancillary networks. So what this means is balance billing or access issues would never occur if they went to a PHCS network provider. And if they decided not to, yes, balance billing and network or access issues could happen. But like I said, those are pretty rare. Just to let you know how rare, balance billing with reference-based pricing and our platform typically happens around 5% of all claims nationwide have been balance billed. So 5 out of 100 times, it's going to get a balance bill. 95 out of 100, they're not going to have any issues at all. And then the access issues is just making sure that they present their card to their to their doctor. And the reason we keep talking about this is because with core value, the nice thing is they can go anywhere. They don't have to worry about staying in network or out of network, no matter their location, no matter where they're on vacation or where they move or where they're going. They can go to any provider anywhere in the country and present their insurance card just as normal. If, like I said, they did have an access issue, they give us a call and we will talk to the provider on their behalf, making sure that they're able to be seen. If they, for some reason, are not, the provider's digging in their heels, we'll find them a provider that will see them for their service in that area. Here, like I said, is a list of plan design options. It's very, very small. I apologize. It's kind of hard to see. But as you can see here, we've got many different deductibles. We've got many different deductible options, co-insurance options, out-of-pocket, different offices at co-pays. So for us to just say, hey, here's a list of, the hundreds and hundreds of plans that we can tweak for you, just make sure that you're having good communication with me, using me as a reference and using me as your helper to kind of help figure out what's going to be important to your clients and how we can make sure that we're presenting them with a plan design that's what they want. I will mention our plans are a major medical plan, and everything is going to be ACA compliant. So preventative is all covered. It aligns with that Affordable Care Act requirements. This is not some type of plan where it's like a MEC plan or a minimum essential coverage plan. This is a full, they can receive a full PPO. This is a major medical plan. So the sales process, really easy. It's supposed to be as easy as 1, 2, 3. I will be your direct contact here at Allstate Benefits if you have a group or any quotes that you're wanting to run. The first thing that you need to do is get a base quote. We need a census with genders and dates of birth, business information with zip code, and renewal if possible. If they're a virgin group, I know that they won't have the renewal, and that's okay. We can provide one without. With this base quote, we assume that everybody that's going to be coming on the plan has standard health. So these are kind of best case scenario rates, and that's why we ask for the renewal. We want to make sure that the savings potential is there before we have you go and get applications. To get firm rates, we do need health applications from anyone who's planning on taking the plan. Our underwriters will take a look at these applications, and then we'll rate their medical as well as their prescriptions to give us a firm rate. So your initial base quote rates can change based on the health of the group. This is where you come in as the agent, making sure that when you present the base rate, hi, Mr. or Mrs. Employer, here's the base rate quote and best case scenario. The savings potential is there. The only thing that they're going to do, or the rates will change based on the medical of your employees. And this is where you kind of have to do a little bit of field underwriting, asking, so do you know the overall health of your group? Sometimes they will, sometimes they won't. Typically, small businesses do know a little bit of information about the the employees and their families, just because of the group sizes that we tend to work with. But nobody knows fully what the medical of the entire group is until we get applications. But if they would say to you, oh, these rates look good, but, Melissa Cook, she was just diagnosed with breast cancer and she's going to be doing chemo and ongoing chronic treatments. Probably not a good fit. If the employer says, oh, Melissa Cook has high cholesterol, high blood pressure, those types of things are no big deal. I'm located in Wisconsin. We drink beer and eat cheese curds on the daily. And so we know that high cholesterol, we know that, diabetes, anxiety, things like that are very, very common. And so with low rated conditions like that, we will not necessarily put a dollar amount on them as long as it's not somebody that has a high build, diabetes, high cholesterol, and has all these underlying issues because they have more than one of those minor conditions kind of paired together. This is where, if you do have questions or you want to run something by me, hey, Melissa, I just spoke with the group. I think they're a prospect, but this is what's going on with the health. Please give me a call, and I'm more than happy to assist you and kind of guide you in the way that I think is going to be beneficial for you and the group. Lastly, after we get firm rates, if the group decides to sell, we have the employer fill out a short application. It's, I think, about 4 pages. It's just basically tax ID numbers, do they want to offer COBRA, the census, and then we send all the documents to them via DocuSign once we get that sold paperwork back. So we make it very, very easy. Keep this in mind for groups that maybe are traveling or groups that are out of state or kind of a far drive for you. We give you all the electronic tools to make sure that this is as easy as possible. So we talked about the quote proposal. This is what our quotes typically look like, except for they're going to be branded at the top as Allstate. And here is, all the different things that you'll see as part of that proposal. They will look the same. These rates, for now, we're going to say are preliminary. Once we get the applications, they would be final. But you guys know, it does the deductible, the co-insurance, the out-of-pocket max, lists everything right here for you. We also give you some dental options in case they want to pair with ancillary. It is going to be on one bill. So you can see here at the bottom, the medical cost and then the dental cost. And then we give them a few different dental options depending upon what they would like. And then this is optional. So if they decide just to go with the health, that's fine. The only thing that I would say is that make them aware whatever they elect for the health, they have to elect that tier for the dental. So if they're enrolling in health as a family, they can't enroll in dental as an employee only. They have to have that same tier election. So the biggest thing that I found with working with AHCP agents is some of you might be seasoned, some of you might not be. Who is a good fit? You want to target groups that you already work with. Maybe you sell other lines of insurance to them, whether that be individual or PNC. If you know any group owners or people that are looking for insurance for their businesses, maybe for tax purposes, talk to them about groups. Groups 10 to 25 are our sweet spot. We will write groups anywhere from 2 to 500 enrolled. Depending upon what state the group is located in, make sure that you pre-qualify with them with me and making sure that we make sure that they're a good size fit. The reason that the group might not be a good fit as far as size, because we can write anywhere from 2 to 50 in the small group space, is dependent upon where the group is located. Each state has its own requirement as far as how much the group has to fund their claims fund. For example, Florida, your group size has to fund at least $20,000 putting aside in their claims fund. In Wisconsin, it's $6,500. So how that makes a difference, or how you can put it into perspective, if you're setting aside $20,000 and you're going to divide that $20,000 amongst 5 people versus $6,500 divided amongst 5 people, that group with a $20,000 claims fund is obviously going to have a higher cost. So depending upon how much your state regulation is to set aside the money is going to depend on what's kind of your sweet spot for the group. And I know it can get confusing. I know this is totally like so much information for you guys right at the busiest time of the year. So please, if you have any questions or you want something clarified, reach out to me, shoot me an email, give me a call. The other thing that you want to do is do you sell individual insurance, and have you been putting any individuals on a group on individual plans? If you are, make sure that you're asking them about group coverage, taking advantage of those tax purposes, offering a little bit stronger benefits, and potentially a savings there for your clients is really going to be huge. Referrals are your best friends, so making sure that you're asking for referrals. It's busy now. We don't have all the time in the world to be cold calling and prospecting like we are at other times of the year. And so referrals during a busy time is really going to help you have your clients do the legwork for you during this fourth quarter. Like I said, when's the last time you cold call on a small business in your area? Kind of unlikely right now because of how busy we are. But if you do have the time, or you find that you're a newer broker, or maybe you have an admin, you could maybe have them help you out doing some cold calling. And just remember, if you're working with any business owner in any capacity, to make sure that you're talking about group health. Think outside the box. We are a nationwide carrier. We don't just work with AHCP. We work with brokers across the country. And so if you're not talking about us or level funded, somebody else in your area could be. And so you want to make sure that you're just seizing every opportunity to provide your client with a value savings, as well as just making sure that you're bringing value to the table as well by having everything that you need, talking about fully insured, talking about ancillary options, and then talking about group health as well if you see fit. So I'm going to stop here.
All righty then. Melissa, thank you again for your time today. And everybody else, I appreciate your getting involved.
Yep, absolutely. Thank you. Happy selling. Please reach out if you need anything, and I look forward to speaking to you all more.